Before we can talk about specifically what is acne, we need a basic understanding of 3 important points. The first point is this: although you cannot see with your naked eye, our skin is actually comprised of these tiny little holes, and these holes traverse the entirety of our skin surface area. Okay, you can refer to them as pores or follicles, but the idea is that the skin is full of these tiny little holes. The second point is this: deep within those holes are sebaceous glands. Now, the function of the sebaceous glands is to produce something called sebum. Sebum is like this fatty, oily substance, which is your body's natural moisturizer. So when your skin is dry, your body ramps up the production of the sebum to moisturize the skin. The third point is this: also deep within these holes of the skin lives bacteria. It's anaerobic bacteria, which means that the bacteria doesn't rely on oxygen to survive. And this bacteria is aptly called Cutibacterium acnes. So, as I'm sure you can imagine, this bacteria, C. acnes, is the bacteria that's implicated in the pathophysiology of acne. So now that we have a basic understanding of the players, what is actually occurring in acne? The first step is the clogging of the pore. So once the hole gets clogged and filled, the bacteria that's living within that hole, the C. acnes, is chilling, all right? Interestingly, the sebaceous glands that produce sebum, they continue to do so. So the sebaceous glands are producing sebum, and which is really interesting is that the acne, the C. acnes, the bacteria, can actually eat the sebum and use the sebum as a fuel source. So from the bacteria standpoint, dude, this guy's chilling on vacation, right? He has a roof over his head because the actual hole is clogged. He got plenty of food on the table. The sebaceous glands are producing sebum, so he's chilling, roof over his head, food on the table. What is he gonna do? He's gonna enjoy himself, he's gonna multiply, he's gonna cause a small little infection. That tiny little infection triggers an inflammatory cascade, which results in a pimple, aka acne. All right, now that we have a basic understanding of what is happening in acne, what are the players involved in acne, we can start thinking about the different treatment interventions and the different treatment modalities. Stay tuned for the second video where I'll touch upon the different treatment options.